Hi, my name is Michael, and I'm an acupuncturist on the acute pain service at Harborview Medical Center. In this video, I'm going to teach you an acupressure routine which you can do safely in your hospital bed, which may help reduce stress, anxiety, pain, as well as help improve your sleep. Acupressure is based on traditional Chinese medical techniques, which have been found helpful to calm the nervous system. But please, if you find any discomfort while you're doing these techniques, please feel free to stop and ask someone for some additional help. Before starting these techniques, it is helpful to first focus on your breathing. Breathe in and out through your nose, slowly and deeply, into your lower belly. Breathe in to the count of 3 and breathe out to the count of 4. Just focus on making the out-breath a little bit longer than the in-breath. Breathing this way for a few minutes before you begin acupressure can often make the acupressure more effective. The first point is called large intestine 4. It is located on the outside of your hand, where the thumb and the index finger meet in the muscle that you find there. To apply pressure to this point, place your thumb on top of this muscle and the rest of your hand and fingers underneath to support your thumb. Apply firm pressure to this point in a circular motion. Apply just enough pressure to feel a dull and achy sensation when you press, but it should still feel comfortable and not be painful. If it's easier for you to massage this point by switching the fingers this way, please feel free to do so. Massage this point for 1 to 2 minutes or 5 to 8 cycles of breathing in order to receive its benefits. And when you're done on one side, switch to the other hand and do it the same way there. The next point is called large intestine 10, and it is located near your elbow. To find this point, take one arm and lay it across your abdomen. Take your other arm and hold onto your elbow with your fingers underneath and your thumb on top. Place your thumb where the end of the elbow crease meets, and then slide your thumb about 2 inches down. This point is inside of the muscle belly, and you will press this point in an up and down motion, going towards your elbow and then towards your hand. You will do this slowly, but applying firm pressure, so that you feel a dull, achy sensation, but it should still feel comfortable and not painful. Continue pressing this point for 1 to 2 minutes or 5 to 8 cycles of breathing in order to receive its maximum benefits. When you are done with one arm, switch to the other arm if you are able to do so. The last point is called Shen Men, and it is located on the ear. To find this point, take your index finger and find the front edge of your ear. Slide your finger back about 1/2 inch until the finger falls into a big hollow. Then take your thumb and place it behind the ear so that the 2 fingers are almost touching. To massage this point, you will slide your finger from the front towards the back of the ear, then go back to the start and do that again, massaging in a straight line. Use enough pressure to where you feel a dull, achy sensation while it's still being comfortable, and massage this point for 1 to 2 minutes or 5 to 8 cycles of breathing in order to receive maximum benefits. And when you are done doing acupressure on one ear, if you're able, do it on the other ear too. To finish your acupressure session, place your hands on your lower belly and feel the heat that is coming from your hands, and let the heat go deep into your lower belly. Breathe in the heat for a couple of minutes in order to help conclude the session. By now, you may be feeling pretty relaxed or a little bit sleepy, in which case you should let yourself rest. But consider doing this exercise once or twice a day while you're at the hospital and then at home in order to continue to receive the healing benefits. If you have any questions about acupressure and whether it's right for you, please contact an acupuncture staff member at Harborview for more assistance. Thank you.